Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. This is a webinar about Lyme disease, and you create the webinar with your question. I wonder what you have in store for me tonight, and I hope you all don't stump me too much. I try to answer all the questions as best as I can. Occasionally, I will get stumped, but we'll see how that goes this evening. So we have probably the largest audience that's ever signed up for these before tonight. And so actually not probably, it is the largest audience that we've had. So I see a lot of new names on my message board. So I'm glad to see that there's new people here tonight. For those of you that are here for first time, the way you participate is you can either listen to the questions and responses that I give, or you can write a question yourself. And the way you write that question is over on the bottom of the screen on the right-hand side of the webinar is a chat box. And you can write your question to me through that chat box. I ask that you try to keep it brief. Long questions don't work out well in this format. And if they're too long, I won't post them at all. I am going to read the questions during the webinar out loud so that those people that are participating in the recorded version can actually hear it. The questions actually, for those of you that are here in the live version, the questions will show on the bottom of your screen. So I will post them so you can see them, but they don't show up in the recorded version. For those of you that are here again, that have returned, I'm glad to see you keep getting value out of this, and I hope you get some more value tonight as well too. For those of you that are here, I ask that you keep spreading the word about the good work we're doing here in terms of trying to get the messages out about Lyme disease and options to help people recover. So if you do find benefit, please share the emails that I send out announcing these webinars as well as the recordings to other people that you know might benefit as well too. Okay. Help me to reach as many people as possible. I'd appreciate if you do that so they get some benefit as well too. Okay, so without any further ado, one last thing. We will not get through every question tonight. I will try my hardest to work through these, but there'll be a lot more than I'm able to get through tonight. So we'll start working through them. All right, so let's go ahead and get started here. This is our first question. This is from Joyce. Hi, Joyce. Let's see. Hi, Dr. Ross. Your thoughts on the impact of thyroid function on Lyme-related symptoms? My understanding is the health of the thyroid is directly tied to the Epstein-Barr virus, which could be triggered by mononucleosis. And how do you get your doctor to run a full panel thyroid and Epstein-Barr virus test? Responses always the same. Everyone has had Epstein-Barr virus at some point, so no reason to test. TSH is all you need to determine thyroid function. And as an aside to this, about 15 years ago, I had Lyme and Bartonella for 20 years. I developed dark patches around my ankles. No doctor has answers. I read someone had their thyroid removed, put on Synthroid, and dark patches around ankles disappeared. Thank you as always. Stay safe and well. All right. So Joyce, thank you for the good wishes there in the end. So first of all, I'll talk about the thyroid, but I want to talk about Epstein-Barr first. So Epstein-Barr, everyone, is the monovirus, okay? And I actually am in the school of thought that says it is not a real infection that you need to worry about in chronic Lyme disease. Now, I know some practitioners treat it, but I don't find it generally helpful to do so. And let me tell you why. So Epstein-Barr is a very common virus that is found even in healthy people. And in fact, if we were to pull 100 healthy people off the street and we were to test them for antibodies for Epstein-Barr, we would find that they have that about 10 to 20% of those 100 people have elevated antibodies against Epstein-Barr. Okay, so this is healthy people. 10 to 20% will have elevated antibodies, okay? So now when we do Epstein-Barr testing in somebody that has Lyme disease and it comes back positive for Epstein-Barr, that does not mean that the Epstein-Barr is part of the problem. It may be that your immune system is just doing what it's supposed to be doing, which is keeping the germ under control as it does in healthy people, okay? Now, there are times I will think about treating for Epstein-Barr, and that is if I've treated somebody for Lyme and we're about 6 to 9 months into treatment and they're not getting any better, then I start wondering, did their immune system, because of Lyme immune suppression, lose the ability to keep these common viruses under control? At that time, I might consider treating. Now, the problem with doing antibody testing against Epstein-Barr, and that's how most doctors look to see if you have it, is that there's some doctors that have an opinion that if you have high levels of Epstein-Barr antibody, that it must mean the germ has gotten active. All right, but I'll give you a different argument on that. And that is, if you have high antibody levels, it may mean your immune system is doing a great job keeping it under control. All right. And we have no adequate studies that prove whether high Epstein-Barr virus levels mean the germ has gotten active. So there's a group of viruses and bacteria that coexist in us, just like we have germs living on our skin. Okay. And some of those viruses, for instance, are Epstein-Barr virus, human herpes virus type 6, human herpes virus type 8, cytomegalovirus, Epstein-Barr virus, two bacteria. One's called Chlamydia pneumoniae and one is called Mycoplasma pneumoniae. And generally, our immune systems keep them under control. And so if they do get active, it probably is because Lyme has suppressed the immune system. So the reason I don't even bother looking for them or even treating for them is that my approach to dealing with those, if they could be active, is get the Lyme and the co-infections under control and get mold toxicity under control if you have it, so that your immune system will do what it's supposed to do, which is keep those germs under control. Okay. All right. So I just want to address that. And I don't agree that thyroid has anything to do with Epstein-Barr virus, to be honest with you. Okay. All right. Second part of your question was, how do you test for thyroid? So the way that unfortunately, there is an opinion among conventional medicine that if your thyroid stimulating hormone, TSH, is normal, that you must have normal thyroid levels in you. So let's talk about that. All right. So your thyroid gland sits here in the neck. Okay. And it makes two kinds of thyroid. One is called T4 and the other one is called T3. And what tells the thyroid to make thyroid hormone is a chemical made by your brain called thyroid stimulating hormone. And the current viewpoint in medicine is that your brain is always right. And if your brain is making a normal level of thyroid stimulating hormone, it must be correctly interpreting that you have adequate thyroid in you. And that's all we need to do is check the TSH. But that's wrong. It doesn't fully find the whole picture that we see in chronic illness, okay? And chronic illness, you want to do more than TSH, all right? You also want to measure the thyroid chemicals that are made by the thyroid gland. So you want to get a free T3 and a free T4. The other thing you want to do is something called a reverse T3. So let's talk about that for a minute, all right? So thyroid, many of you may know, kind of sets the idle speed at which we run, all right? And 90% of the thyroid that's made by your thyroid gland is T4, and about 10% is T3. All right. And the main difference there's two main differences between T4 and T3. First of all, T4 has 4 iodine particles on it, and T3 has 3 iodine particles on it. Okay. So we're pretty simple in medicine how we name things. So T4 has 4, T3 has 3 iodine particles. All right. So that's one difference. Okay. Second difference is all of this T4 that gets made has to be converted into T3, because it's T3 that is actually active in your cells and in your tissues and gives you energy. Now, the body sometimes will try to put you into hibernation. If you're really sick, sometimes what happens is the body will try to put you into hibernation, slow your metabolism way down. So what happens is that T4 is supposed to become T3, okay? But sometimes if the body is really sick and trying to go into hibernation, instead of making all this T3 over here, it'll wind up going over here and make reverse T3, all right? And if you make a lot of reverse T3, that means you got low T3, and that makes you slow down and get really tired, all right? So a full way of looking at thyroid would be to measure TSH, T4, T3, and reverse T3. And the standard model that doctors do of only trying to measure the TSH from the brain does not work in chronic fatiguing illnesses. You actually need more information than the TSH alone will give you, okay? Now, a lot of doctors don't get that. One thing you could look at is to try to convince them to do all these things is to show a pretty detailed article I wrote about this. And you could actually print it off and show it to them. So let me show that article to you. All right, so to take a look at this, find this article, go into the hormone section of my online Lyme guide and take a look at this article called Hypothyroidism, the Best Test, Medicines, and Vitamins, okay? That's the article you want to look at. I have a lot of detailed references here. This is an article I actually wrote when I was having to argue with my medical board over my management of thyroid. And this is what got them to leave me alone. So take a look here, okay? All right. Thanks for the question, Joyce, and good luck to you. All right. Hello, Tomas. Let's see. Hello, Dr. Ross. I hope your anniversary date went well the other week. Did I actually say it was my anniversary? Huh, interesting. Well, it did. Let's see. I have been treating Bartonella for months and making good progress with all of my serious symptoms, except for the loss of sensation at the tip of my middle and index fingers. Should I be looking for causes other than Bartonella for this? Thank you. So there's the part of the problem is one of the things that can sometimes happen in Lyme and in Bartonella is that the injuries from the germ can be permanent. Okay, so one thing that could be happening here is, although all your other Bartonella symptoms may be getting better, if this is an area that's stuck, it could be it has some permanent injury. Okay, it could be. I'm not saying it is, but it could. Okay, so common things that you want to look at regarding neuropathy to find out if there could be another cause would be check vitamin B12 levels, check vitamin B6 levels. If you actually have too much B6 in you, it can lead to neuropathy as well too. And sometimes people in Lyme use a lot of vitamin Bs, and you might be getting too much B6. Okay. Let's see, what else would I check? Probably somewhere along the way, somebody's done kidney liver testing with you, but I would look at those because if they're not working correctly, sometimes that can lead to neuropathy actually too. Okay. Those are the main things I would go looking for. Kind of another thing you could look at would be to do heavy metal testing. If you have too much heavy metals in you, that can sometimes lead to nerve injury and damage as well too. Okay. All right. Good luck to you. Thank you for that question. Hello, Gail. Let's see. Hi, Dr. Ross. 1, can you heal from Lyme? Or let's see. Can you heal from Lyme if they have severe leaky gut? 2, do you ever use standard processing products with patients, and what is your feeling about them? They are nutrient dense and full of things like bovine spleen, etc. Any dangers in taking these type of products? I remember when mad cow disease was a thing. Can these products help heal Lyme? And 3, if I have had Lyme and co-infections for 15 years and have nerve and vascular issues, etc., haven't done any long-term appropriate antibiotic treatment, do you feel it's possible to still get into remission with herbs and supplements alone? Okay, let's answer that last part. Okay, so if you have Lyme and you've had it for 15 years and you've got a lot of medical problems, could herbs and supplements take care of the problem for you? The answer is yeah. So I find, for instance, when I'm treating in Lyme, using to kill the Lyme germ, the two herbs I'd like to use, herbal antibiotics I like to use to do that, are cat's claw and otoba. And I find that those two herbs work effectively to kill Lyme in 85 to 90% of people and improve their health. That is the same chance of helping you as prescription antibiotics, okay, for the Lyme germ. Right? For Bartonella, if you happen to have Bartonella, the two herbs I like to use that can kill Bartonella are Sida acuta and Hootenea, and they work to help about 70 to 75% of people get well. That compares to prescription antibiotics that will help around 80 to 85% of people, okay? And then for Babesia, the other big Lyme co-infection, I like using the herb Cryptolepis that can help about 80 to 85% of people to get well. Yeah, 80 to 85% of people to get well. And that compares with prescription antimalarials that we'll use to treat Babesia that help to get about 85% of people well. Okay, so yes, it is possible, even with this the length of time that you've had your illness, that you could use herbal antibiotic options to deal with each of these infections. Okay, it's possible. Okay. In terms of the standard processed products, I don't use them, but they're glandulars is what you're referring to. Could you get different problems from using those glandulars? In theory, yes. Will they help somebody that has Lyme? Maybe, maybe not. I don't have a specific impression on them, to be honest with you, okay? And number one, your question was, can you heal from Lyme if they have severe leaky gut? The answer is yes, you can still recover from Lyme with severe leaky gut, but you're going to have an easier time recovering from Lyme if you actually correct the severe leaky gut, okay? All right, so I'll answer that for you. So I'm going to show everyone some articles. If you're wondering what leaky gut is, I'll show you an article on that, and I'll show you some articles you can look at about where you find information about these herbal antibiotics that I mentioned as well, too, okay? All right, so let me do a quick screen share here. All right, so in terms of treating, how do you manage the different infections? Take a look at my online Lyme guide. Take a look at this section on infection treatment plans. Okay, and for information about the herbs that I use to treat Lyme, you could take a look at my full antibiotic guide here. Okay. For information about the herbs and prescriptions I recommend to treat Bartonella, you could look here. And for the information about the herbs and prescription antibiotics I recommend to kill Babesia, you can take a look here. Okay, so these are the main ones to look at. All right. And then in terms of leaky gut, take a look at my section on the stomach and intestines right here. And there is I should have an article here on leaky gut, I believe. Yeah. Here you go. So it's leaky gut syndrome, a treatment guide. I describe what the problem is and the steps you can do to help clear up that problem as well too. Okay. All right. Thanks, Gail. Good luck. Hello, Sai. Let's see. Yeah, Dr. Ross. If a patient who is not a Washington resident becomes your patient, will you still be able to prescribe antibiotics to them, or are prescriptions not available across states? So in my practice, I prescribe across state lines. The only thing that I require is that for me to prescribe to a person, at this point, I am doing it under what's called my full medical service visit. And if you sign up to do a full medical service visit, although we can do it by telemedicine initially, once the COVID infection rates in the country drop significantly, I am going to require at least one in-office visit with you so that I can establish full care formally by doing an exam with you as well too, okay? So yes, I can, but you have to enlist to do what's known as my full medical service visit, okay? So for those of you that are wondering what the heck I'm talking about with full medical service and what does it entail and what other options you might have to see me, take a look at, I'm going to do a quick screen share here. All right, and I'll show you where you can get all these answers. So take a look at my, my practice clinic, my clinic website, you can find here by clicking the clinic link, okay? And this is my practice website, Marty Ross MD Healing Arts. Take a look at my appointments page. And through this page, you can actually book your appointment. But I have two varieties of visits. I have something called a full medical service, and I have a limited consult service. Read all the way down here where I describe what's entailed with a full medical service and what is a limited consult service, okay? The only visits where I can prescribe and order tests occur through this full medical service, and at some point that means you're going to need to come out and see me. At this point in time, I'm anticipating we're probably not talking until the end of the summer until we get enough people vaccinated and COVID rates drop enough in the country that I'm going to start requiring that people do a follow-up visit by seeing me in person, okay? Read through the entire section on both of these to see the difference. I answer all of your questions here, so I'd prefer you read all of this before you call up my receptionist because it is all here, okay? If you have any further questions, you could also take a look at my frequently asked question page right up here at the top. All right? All right. All right. Thanks for that question. Let's see here. Hello, Lisa. Hi, Doc. In your practice, would you customize the disulfiram, DSF is disulfiram, everyone, dosage for patients who, due to drug side effects like headaches, need to start at really low dose and pulsed? Many are staying at lower than target body weight doses for longer periods of time versus ramping up to higher daily doses. What other must-have supplements do you use along with the disulfiram? Thanks. Okay. So many of you are probably aware that we have been using over the last couple of years a drug called disulfiram, which is also known as Antabuse, to treat people with Lyme disease. And so Antabuse is a drug used to treat alcoholism, okay? And the reason it's used to treat alcoholism is if people drink alcohol and they're on Antabuse, the Antabuse stops the breakdown of an alcohol byproduct called acetaldehyde. And if that acetaldehyde builds up to high levels because you're not breaking it down because you're on Antabuse, it's going to make you really sick. You can get a lot of nausea, you might get severe abdominal pain, bad headaches, really feel bad, okay? So it's a deterrent to keep people from drinking. It was discovered out at Stanford University about 4 years ago now, when they were looking to see what agents could they use to treat a type of Lyme, a growth state of Lyme called persisters. It was discovered in lab experiments that it could kill persisters, okay? So let me talk about that real quick. So Lyme, we now know, has two growth states. There's growing Lyme, okay, and there's hibernating, also known as persister Lyme. Hibernating means it slows its metabolism way down and it just starts ignoring all the antibiotics that we throw at it, okay? Another thing can happen with persisters in that they can develop a slime biofilm layer above them too, all right? Now, at this time, the only studies that have been done looking at what disulfiram treats is that it treats persister Lyme. No one has done any studies to say, does it treat growing forms of Lyme, okay? So most of us are not using disulfiram as the first thing we use to treat Lyme, but rather we're doing it either in concert with using antibiotics that treat the growing form, or We will use it in people that we've done a lot of antibiotics that treat the growing form that may not be getting better. Then we're going to try to do the disulfiram there. Okay, that's what most of us are doing. Okay, so keep that in mind. Now, it's possible that disulfiram treats growing forms of Lyme. It's just that no one did any research to tell us if it did. Okay, so just keep that in mind. Okay, now disulfiram has some problems. So first of all, let's talk about the good stuff. So what we know, and this is what I see in my practice, but also Dr. Leaky, who's the first doctor that started using it with patients in this practice, has published his results working with 71 people now. And so he's looking back, he's doing a chart review. So it's a retrospective review. Okay, now keep in mind, retrospective reviews are not high quality science, but they give us some ideas on what can happen. So what he's learned with 71 people in his practice that he's used disulfiram on is the following. Number one, you can get 40% of people that use target dose, that use a high dose based on their weight. He can get 40% of people into remission. And I see something similar to that in my practice too, okay? But there's a number of people, around 30 or 40%, that cannot get up to this quote unquote target dose, okay? So they're not able to get to the full dose. They may still get benefits though. And so his data shows that. I see that in my practice too. There's some people that were not able to work all the way up to this target dose, okay? Now the target dose is supposed to be 4 to 5 milligrams per kilogram of body weight. You try to work up that in a daytime, okay? So what's a kilogram? Well, you basically take your weight in pounds and divide it by 2.2. That's kilograms, okay? And then you would take that times 4 or 5, and you'll figure out the range that you should be in terms of what we call the target dose, okay? Now, people that can't get to the target dose, many still get benefit. It's just that you have the greater chance of getting the most benefit if you can get all the way up to the target dose. Okay, now, there's some problems with disulfiram. Number one, it can be a really hard drug. It can cause some pretty severe Herxheimer reactions. Part of the reason it can cause bad Herxheimer reactions is, in addition to killing these persisters, it appears to be pretty dang good at removing biofilm, slime layers that cover the germs, all right? So that could expose your germs to the immune system, and the immune system gets in there and attacks the germs too, all right? So you get pretty severe Herxheimer reactions. In addition, there are side effect problems. About 50% of people on disulfiram get pretty bad fatigue just from being on the drug, okay? About 30% will develop mental health problems, and about 15% can develop neuropathy problems, nerve injury problems. Now, the neuropathy, when I first started working with the medicine, and Leaky was also suggesting that the majority of people that get neuropathy on disulfiram, if you stop it, it goes away, all right? Or we would think all of them would go away. However, I am seeing a very small subset of people that on disulfiram, they can develop permanent neuropathy. Okay, so you got to be aware when you start using disulfiram, there could be some risk of permanent injury. I think it's about 2% or so of people that develop neuropathy, it will become permanent to some degree. Okay, unfortunately, that's what we're seeing. That's what I'm seeing in my practice too. Okay, all right. The other problem, so just be aware of that. Okay, so number one, 40% of people can get into remission if they can get to the high target dose. A lot of people have bad Herxheimer reactions as we started. 50% or so of people are going to get bad fatigue on it. 30% are going to develop some mental health problems on it. And about 15% will develop neuropathy, of which 1 to 2% of those become ongoing, maybe permanent. Okay. All right. All right. Now, when you're on disulfiram too, you have to avoid anything that might be turned into alcohol or is alcohol. So no alcohol. Okay. No vinegars. And you want to look at your labels on bottles like ketchup or mustard. Mustard has vinegar in it. So, look at the things, condiments that you're using, okay? No fermented foods like kombucha, kimchi, sauerkraut. You want to avoid those. And for people that are really having a hard time with reactions, I also will try to avoid having them on phenols. And phenols can be found in coffee and tea, green tea, not not herbal tea, but green tea. Okay, so sometimes you have to clear those out as well too. Okay. All right. Now, what do I have people on when I have them on disulfiram to try to limit all this reactivity? Number one, I like to have people take zinc picolinate at 30 milligrams one time a day. It may help limit the neuropathy from occurring. Okay. Number two, I like to have people on glutathione because it can help limit the Herxheimer reactions that people get. And to do that, I'd like having people take a liposomal glutathione. A liposomal means it's glutathione that's microscopically wrapped in fat, so it increases its absorption. Okay, so glutathione is great. It helps the liver with detox. As a very powerful antioxidant, it lowers die-off reactions by decreasing oxidation agents that trigger white blood cells to make cytokines. Okay, so it limits inflammation cytokines ultimately, all right? So it improves detox, limits inflammation cytokines from being made. And finally, glutathione is the master reparative, fixes everything antioxidant that is naturally made within our cells. But if we have injury, our cells sometimes exhaust their glutathione. So taking glutathione helps repair damage. Okay, so that's why I like using glutathione. The product I like for it is a product called Trifortify Orange or Trifortify Watermelon. They're both manufactured by Research Nutritionals. The company's got great data on research that they've done showing really good absorption of this stuff, okay? So that's why I like using it and I have good results with it, all right? The other thing I like to do to limit this Herxheimer reactions from happening is to have people be on curcumin or quercetin. Actually, curcumin. Curcumin is a component of turmeric. It gets inside your white blood cells and blocks and limits their production of cytokines, okay? So when you get a Herx reaction, one of the reasons you feel bad, the main reason you feel bad actually, is the immune system, when it sees all these dead bug parts, reacts by making inflammation chemicals called cytokines. And cytokines make it so you can't think, make you super fatigued, make you hurt all over, interfere with how your hormones work, disturb your sleep centers. Cytokines actually give you Lyme symptoms. And in fact, when you have Lyme in you, the reason you feel badly is your immune system manufactures too many cytokines, okay? And your immune system makes more cytokines when it starts killing germs, all right? That's called a Herx reaction. So we can limit them by having you on the curcumin. I like using a liposomal form of curcumin too, and that's a product made by Thorne called Mariva 500, one pill, 3 times a day, okay? So it's kind of my base package. I have people on glutathione, I have them on curcumin, and I also have them take zinc picolinate to prevent neuropathy. Now, if somebody starts developing neuropathy during treatment, even on that, then I have found it useful at times to have them start taking B vitamins, okay? Sometimes I find that helpful, but I don't routinely start them on that, okay? All right. Anyhow, those are my thoughts for you, okay? Good luck, Lisa. Oh, and for those of you, I'm going to show everyone, do a quick screen share here. Part of your question too, Lisa, was, can you go low and slow? Yeah, you can. I will work with people at a level that they can tolerate, okay? My typical starting dose is 62.5 milligrams, but I've gone even much lower than that if we need to as well too, okay? All right. So for those of you that want more information about the risk of disulfiram, using disulfiram, what supplements to use, etc., let me show you where you can find that information. So I've got a pretty, this is my supplement website. Any supplement that I'm mentioning here today, if you're looking for a source for it, you can find it here. Anyone can use my supplement site, okay? Keep in mind right now, I ship my products out of Austin, Texas, and the reason I have my shipping there is I was trying to make sure we could reach the whole country easier rather than keeping my shop here in Seattle. But the problem is right now, it's a mess down there with the Texas freeze. We are still taking orders, but I want you to be aware if you were to order something now, it may not go out until Monday. Okay, so just be aware of that. We got some shipping delays. And my prayers are with my people that I know down in Austin. I live down there for a bit, so my prayers are out for those people down there as well too. Okay, all right. So anyhow, let me go here. So okay, so this is my Lyme disease information site, and in terms of finding my article about disulfiram, where I review all these stats and talk with you about the things I do in my practice with it. Take a look here. This is the article, Disulfiram for Lyme Update, okay? You've got a video to go with it, and I talk about Dnrs data. I have the whole listed out right there, and then et cetera, et cetera. I talk to you even about maybe even using regular antibiotics along with disulfiram when you might want to do it. The last thing I'm going to tell everyone is disulfiram does not work for Bartonella, okay? We know that from research that came out of Johns Hopkins University earlier this year or last year where they looked at it, and so it's not a useful agent if you have Bartonella. All right. Thanks for the question. Hello, Tim. Hi, Dr. Marty Ross. Thank you so much for all you do. You're welcome. I'm wondering what the best way is to protect the liver on disulfiram. My liver enzymes are elevated, specifically the alanine aminotransferase, which is 300% of normal range. I'm not sure how to proceed. Thank you, and I hope you're doing well. So, Tim, glutathione. Glutathione, glutathione, glutathione. So remember I said glutathione fixes injury, okay, and it's used by the liver to detox too. So I would try the Trifortify orange or the Trifortify watermelon. Given the degree of elevation you have here, instead of doing 5 milliliters one time a day, which is a teaspoon one time a day, that's what I normally recommend people do. I would go ahead and do it 2 times a day to see if it can reverse this, okay? So everyone, one of the problems, drawbacks of anti-abuse is it sometimes can lead to low-grade liver inflammation. And so that's what's happening here. So I would try the glutathione, see if that will make a difference for you, okay? It could take about a month to get to see what you're going to have enough benefit from it at all or not, okay? All right. Thanks, Tim. Good luck to you. Hello, Patsy. Let's see. Hi, Dr. Ross. My husband has Lyme and Bartonella. He was taking disulfiram, methylene blue, low-dose naltrexone, rifampin, and a macrobid. He was to add azithromycin and dapsone, but couldn't because he developed a fever, extreme nausea that prevented him from eating. He was shaking and had severe aching throughout his body. His liver enzymes are elevated. He improved after stopping the drugs. He did this 3 times. What will you do in this situation? Would an herbal treatment protocol be equally as hard on his liver? Thank you for all you do for the Lyme community. Okay, so, it's a good question. To be honest with you, I don't know for sure because I would need to ask you a lot more questions about his situation. Having said that, when I get somebody that's having a lot of bad reactions, the main culprit I'm going to look at is the disulfiram. Okay, I'm just giving you a general comment, okay? But for your specific situation, to give you the best answer for your husband's specific situation, I would recommend you actually set up one of my consult visits so that I can help answer that and look at that with you. But just in general, of all the things he was on that could have caused the most reactivity, disulfiram. Okay. And, I know disulfiram is the new glory wonder drug that everyone thinks they need to be on. It isn't for everyone. Unfortunately, it's just not. And even though it does give a 40% chance of getting people into remission, using regular antibiotics and taking other steps to deal with persisters can get you well too. Everyone doesn't have to use disulfiram, and not everyone needs to be on dapsone. before we had disulfiram and dapsone, we got people well anyhow, okay? So I'd be glad to help you take a look at some options and to review that with you. But of all the medicines, the ones that are most difficult that you've listed here are disulfiram, and also dapsone can be pretty hard on the body too. They're just hard drugs. They're really hard drugs. And that even if your husband can't tolerate them or take them, there are other options. We don't necessarily need to have you on such caustic things to get you well, okay? All right. So thanks for that, Patsy. I wish I could give you more specific, but I need to know more about your husband specifically too, okay? All right. Good luck to him. Oops, let's try that again. Hi, Elizabeth. Hi, Marty. Does Lyme affect the vocal cords? I've had Lyme for a few years now. My voice feels like it's thinning out. I read that it could be atrophy or nerve damage. Do you know what might cause this? And is there anything I can do? So, the one thing, so both Lyme and Bartonella can injure the nerves that make your voice work. Okay. And if you are starting to have some difficulty with your voice, it is possible to see that the vocal cords are not working correctly. And the person that could do that would be an ear, nose, and throat doctor. They can use a fiber optic scope that looks down there to see if the vocal cords are even working. Okay. And I would suggest you probably do that, because if it is nerve injury from Lyme and Bartonella, then you need to treat Lyme and Bartonella, okay? And you need to do things to repair the nerve. On the other hand, sometimes people get difficulty with their voice if they have a lot of postnasal drip, for instance, and they're constantly clearing their throat. It can give you similar symptoms, but that is usually more of an allergic kind of problem. You would handle that differently, okay? In terms of things to repair nerves if they've been injured, number one, treat the germs, okay? Number two, glutathione. Remember I said earlier tonight, I feel like I'm on a common theme here, but glutathione is what you use to fix damage, okay? It's the antioxidant that is made in every one of our cells, and its intention is to fix damage. And if we've got something injured, it will probably have exhausted its glutathione supply, and we need to replenish it, okay? So when you got this kind of injury, if it is nerve related, if they see you're not moving your vocal cords, suggesting nerve injury, then I would be doing glutathione, the tri-fortified product I mentioned, 5 milliliters twice a day. The other thing I would do for nerve injury when something is dysfunctional is I also like to try to fix the mitochondria. Mitochondria are the energy factories found in every one of our cells, and sometimes we exhaust them too, okay? And they get injured in the world of Lyme. And so what you want to do is fix those. But I like using to fix the covering of the mitochondria is a product made by Research Nutritionals called ATP 360. It's made up of, it has the fats in it that make up your nerve cell membranes, so it can help repair them. It also has the fats in it, same fats in it that actually repair the covering of your cell energy factories called mitochondria, okay? And so you would take that as 3 pills 1 time a day, along with taking your glutathione. Now, I want to give you a word of caution. So Research Nutritionals has an older product called ATP Fuel. That's not the one you want to get. You want to get the ATP 360. It works better, okay? All right, now, there's one drawback to ATP 360 that I need to mention, all right? So if you are, so ATP 360 has some micronutrients in it too, in addition to these fats. And the micronutrients, one of those is coenzyme Q10. If you are taking something that has atovaquone in it to treat your Babesia, you do not want to take anything with CoQ10. It interferes with the function of the atovaquone, okay? So what has atovaquone in it? Well, atovaquone, Mepron, which is all atovaquone, and Malarone, which has some atovaquone in it. So if you're using those to treat your Babesia, don't do the ATP 360. And that situation, which you would want to use to fix mitochondria and to fix the nerve cell membrane, you would use a product made by Research Nutritionals called NT Factor Energy. and that you would start as 2 pills 3 times a day. And after a month, you could decrease that down to 1 pill 3 times a day. Okay. All right. So let me do a quick screen share to show you the difference between these products and also what you can do for nerve repair as well too. Good luck to you, Elizabeth. All right. So for so for information about how you repair nerve injury, look under my neuropathy page here somewhere. Let's see. Oh, brain and nerves. There it is. Brain and nerves. Okay. Take a look at this article called Neuropathy Repair. Okay. Where I talk about treating your infections and in addition to the steps you can do to fix the injured nerve and the mitochondria. Okay. All right. Yeah, I think that covers that. All right, let me go back here. All right, Elizabeth, good luck to you. Hello, Doug. Hi, Dr. Ross. Thank you for your support for the Lyme community. You're welcome. Let's see, do you use Coartem for Babesia in your practice? How does Coartem differ from other medications like Mepron or Malarone? Okay. So yes, I do use Coartem sometimes in my practice, but I use it as a later resort if nothing else is working. In general, I find it to be one of the lesser effective Babesia treatments and maybe works about 70% of the time or so. Okay. All right. So I'll just start by saying that. Okay. So Mepron is atovaquone. Malarone is atovaquone with a quinine derivative called proquinol in it. Okay. Though I tend to go these days, I'm going to start more with the Malarone as a way of treating. Now, Coartem. All right, so all of these drugs that we use to treat for Babesia are actually designed to treat malaria. All right, and that's because Babesia is a blood parasite that functions and acts a lot like malaria, which is also a blood parasite. Okay, so the same things that work for malaria seem to work for Babesia. I will tell you, in terms of research, the only one that's actually ever really been researched to see if it will make a difference for Babesia is Mepron along with azithromycin. All right. And so often insurance companies are only going to pay for Mepron because you can show them a study on that. But if they're going to try to deny coverage, there are no studies that show Coartem works. There are no studies that show Malarone work. Okay. It's based on most of us that treat Lyme use these antimalarials and we see benefit. But insurance companies like to block it, treatment and paying for treatment, unless you can show them some science that's been done looking at this, and it just doesn't exist. Okay, so I just want to make you aware of that. Okay, Coartem, the way that it works is it causes hemoglobin deposits or iron deposits to build up within Babesia, and it can kill it. Okay, and the way that I use it is I have people take 4 pills. Twice a day, 3 days in a row, and then I have them off for 11 days. Some practitioners use it different than that, but that's the way that I've been doing it. Again, it tends to be weaker compared to the Mepron and Malarone in my experience. That doesn't mean it won't be the solution for you, okay, and your illness that you have, okay? All right. Thanks for that question. Hello, Jane. Let's see. I was diagnosed with Lyme, mycoplasma, and chlamydia pneumoniae 3 years ago. My doctor just did labs for all 3, and I still have IgGs and IgMs despite antibiotics and herbs, and now starting disulfiram. What does this mean? So first of all, let me clarify. So in I'm going to start by making just a general statement. We do not have adequate testing to tell us where we are in a treatment. I know some of my colleagues are starting to do repeat Lyme testing and everything, but it makes absolutely no sense to me. Okay, let me try to explain this to you. So a lot of the testing that we have out there is measuring whether you have antibodies that you're making against germs. Okay, and those antibodies fall into two families. There's IgM and IgG antibodies. All right. Now, when you first get sick with an infection, it is IgGs that you develop, and they eventually get replaced by IgG antibodies. So in 99% of infections that we get, IgMs are supposed to go away after an acute period, and they're supposed to be replaced by IgG. There is one known exception to that, and that is in Lyme germ infection, not Bartonella, not Babesia, but in Lyme germ infection. We know from some studies that were done when the NIH was conducting antibiotics research to see if long-term antibiotics would work for Lyme. We know from some of the data that they published with that around 45 to 50% of people that have chronic Lyme disease keep making IgMs down the road years or more after they had an infection, and they don't seem to go away even though they're supposed to. Okay. So in the world of Lyme infection, an ongoing IgM is meaningless. For some reason, people keep making them and we don't know why. Okay. Now, there has been no research that proves that this happens in Babesia or Bartonella, or in chlamydia or in mycoplasma. And if the IgMs are remaining positive, it probably is a false positive test in terms of them remaining positive. Okay. Now, IgGs. IgGs are the memory of the immune system. Once we make them, we're going to keep making them. They're the memory of the immune system. Okay. And some of my colleagues have an impression that as you treat, your IgG levels should decline. And I have to say, what proof do you have of that? So what we're really interested in is your germ load going down, okay? And we don't have any science that tells us the amount of germs in you actually correlates with the amount of antibodies in you, all right? And let me try to explain why that may be. So number one, if you have immune suppression going on, if your germs have gotten really active and they suppress the immune system, that can give you low antibody levels. So if you're treating somebody, you go back and you keep trying to remeasure their antibody levels to see if you're getting better, and suddenly you've got lower levels, it could have nothing to do with germ load. It may mean that your germ got more active and suppressed the immune system. So we think that, oh my God, your antibody levels are lower, you must be getting better. It actually could mean you're getting worse. So it makes no sense to me that my colleagues keep doing these repeat antibody testing, because it doesn't necessarily correlate with germ load. They think it does, but where's the proof? No one's done research to show that, okay? Likewise, you could make the argument that a high antibody level may be occurring because you now have killed so much germ that you have less immune suppression. Therefore, your IgGs can go up higher because they're no longer being suppressed, okay? So it's pointless. It is absolutely pointless. And I find it absurd that the number of physicians out there that are suddenly deciding they need to do repeat antibody testing when we have no evidence that shows it has anything to do with germ load, okay? So what I would say is don't trust the test. That's what I would say. The only way you know if you're really getting better in this disorder or if things are working is if you're getting better. That honestly is the only way to do it, okay? Let me see if I answered this. Yeah, I think I just answered that. It doesn't mean anything, unfortunately, okay? All right. So let me just I'm going to show everyone, if you want to read more about this, I've got an article about it. All right, so let's see. I think I have it. Take a look at my section here called The Latest. And take a look. Yeah, here we are. there's an article here called Repeat Lyme and Co-Infection Testing to Check Treatment Status is Not Valid. Okay, it's not. It's not. And I wish my colleagues would stop doing it. They're wasting your money. They're trying to make themselves feel better. But there is no testing that has ever been, any studies that have ever been done that shows antibody levels correlating with whether you are getting better or the degree of germs that are in you. It just hasn't been done. Okay? All right. All right. Thanks for the question, Jane. Good luck to you. Hello, Kathy. Let's see. I tested positive for IgG and IgM for Lyme and several co-infections. Tried the modified Coartem protocol at only 1 drop of each day and got very sick. Do I need to treat for IgG and IgM? And if so, any suggestions for the super sensitive patient? So as I said, Kathy, earlier, they don't correlate with actually germ load in terms of IgG and IgM. When I've got somebody that's super sensitive, there's a few things I want to do as part of treating them. Number one, I want to look and see if they might have something called mast cell activation syndrome. Okay. Number two, I want to see if they have too many yeast in their intestines. And if you do that, sometimes can make things a lot more sensitive or trigger happy. Okay. And then number three, if we've looked at those and they're still having a hard time, I'm going to consider, is there mold toxicity in them? Because that can make somebody very hyperreactive as well too. And then finally, let's say there is no mold toxicity, you don't have mast cell activation, and yeast have been taken care of. Then what I want to do is work really low and slow, even if it means half a drop 1 time a day. I sometimes will do that and can get people well. Okay. All right. So let me show you some articles you can take a look at here for the things you want to look at. Let's see here. All right. I think I may even have an article on this. Hold on here a minute. Oops, it would help if I spell correctly. Yeah. So I do have an article that is about how, let's see, it's called Extreme Medicine Sensitivity and Reactions in Lyme. Okay. And I talk about, actually, I guess I may need to update this one. I don't have anything about mold toxicity in here. Anyway, I do talk about mast cell activation syndrome. I do talk about yeast, and I do talk about lowering cytokines. Okay. So you may want to, as a starting point, take a look at this article here. Okay. And then in terms of studying for mold or looking to see if you might have mold toxicity and why that can be an issue, take a look in my detoxification chapter here and take a look at this article on mold toxin illness for an approach to see if that is part of the problem as well too. All right, Kathy, good luck to you. Hello, Margaret. Let's see, some people with Lyme report that ivermectin really helps them. Would you please comment on ivermectin? So ivermectin is an anti-parasite medicine. It was designed to treat parasites. There have not been any studies done that report that it can kill Lyme. There have not been any studies done that report it can kill Bartonella. There have not been any studies done that show it can kill Babesia. Okay. So it may treat parasites in the intestines. It also appears to have some antivirus properties. And for instance, has got some weak data showing that it might be helpful in people that get acute COVID-19. And I do recommend it as a potential treatment for acute COVID-19. I can show you about that article there. Why people are getting benefit, it is not something I use in my practice to treat Lyme, Bartonella, or Babesia. Okay, I might use it if I think somebody has specific intestinal parasites for which it might be helpful. I might do that. Why people are getting benefit from it, I don't know. Because if we look at what the science says, it shouldn't do anything to kill Lyme or the germs, okay? I think, and I will also tell you, I think it is getting to become a fad drug right now, okay? Now I say that in all, I mean well by saying that, okay? So many of you are familiar in the world of Lyme. If you've been around the block long enough, if you've had chronic Lyme for a long period of time, you know that in the world of Lyme disease, there are the IT treatments of the season, the treatments that everyone flocks to and claims benefit. And after we use these treatments for a year or so, we find that they really don't do much overall, okay? And suddenly, ivermectin is starting to fall into that category. People are reporting online benefits, so other people want to try it, and so everyone's starting to try it. And I think ivermectin is falling into that. I'm skeptical that this one will have long-term benefit for most people. Why people may be reporting benefit is maybe due to the placebo effect, okay? And I don't mean to say that every time that somebody gets better in Lyme, that it's always placebo effect, but we have to be aware that any drug or herb that we use may have upwards of about a 20% chance that you feel better as what we call a placebo effect, meaning it has nothing to do with killing germs or any other action. It's just that you feel better because you tried something new, okay? And that could be what's happening here too. But in terms of what I know, it should not do anything against bacteria. It doesn't do anything against Babesia. It could treat intestinal parasites and has some antiviral activity, and there is some data showing it may be beneficial in the world of COVID-19, okay? All right. And I think it's become a fad drug at this point too. Okay. It's become one of the drugs of the season. Okay. All right. Let me do a quick screen share and I'll show you my COVID-19 article so you can see how I use it in COVID-19. All right. So okay, this is my article on COVID-19, and I talk about various prevention strategies, including some supplements, for instance, to boost your immune system. But I also talk about what you can do if you get it acutely. And one of the drugs that can sometimes be helpful is the ivermectin, okay? I describe it, why ivermectin might work more up in the body of the article up here, but down here I tell you how to use it, okay? All right. Hello, Damien. Hello, Dr. Ross. So grateful for your wisdom and advice here. You're welcome. 2 questions. Does Lyme cause severe nerve inflammation or damage? Can you treat and heal this? And number 2, what could be causing a lot of cracking and popping in my neck, hips, ankles, and feet? Are there supplements like collagen or something that can help this? All right. So I'll answer the second part of that first. So it's a very unique phenomenon for people with Lyme that they'll have a lot of cracking in the joints. So, and by Lyme, I mean Lyme infection. I don't think this is being occurring, or what I see is it's not from Bartonella, it's not from Babesia, it's not Leaky, it's not any of the chronic virus infections, it's not Mycoplasma, it's not chlamydia, it's Lyme, okay? So often, as you treat the Lyme infection and you start to get it under control, the cracking and popping in the joints goes away. Why we have cracking and popping in the joints is a mystery to me. I have not seen a good scientific explanation. I do think in some people what happens is the joints, Lyme likes to burrow into tissues that don't have good blood flow, okay? And the ligaments, which are tissues that hold your joints together, hold one bone to another, those ligaments don't have much blood flow to them at all. And Lyme, in trying to burrow into those tissues, may break down some of the connective tissues that gives the ligaments force or tension, okay? So they become a little bit more lax, and that can microscopically lax, not not like you can stretch your whole joint apart if you try pulling it apart, but they might get just a little bit more lax and flexible. And that gives you that can give some snapping of the joints when that happens. Okay, that's what I think it's from. The treatment is not necessarily to do any collagen or to do any of those other things. The treatment is get your Lyme germs under control. Okay, by killing them, basically getting rid of them somehow and killing them. Okay, all right. And then in terms of the nerve inflammation and damage, you can treat it and you can heal it. Okay, and I showed you an article earlier, but I'll go back and show that to you again. But I'll talk about the high points. All right. So number one, you got to get the germs under control that are causing the inflammation of your nerves. Okay, typically those are going to be Lyme or Bartonella. Okay. Number two, you need to lower inflammation in those nerves. And so what I like using is the curcumin that I mentioned to you earlier tonight, the liposomal curcumin, the Thorne product called Mariva 500 milligrams 3 times a day. Okay. Number three, you want to start repairing the nerve injury. And again, remember I said earlier tonight, glutathione is your master antioxidant that is made in every cell to repair damage. But if you've got damage to the nerve cells, for instance, they're going to have exhausted their glutathione supply. So you need to give more. Okay. And so liposomal glutathione, which is the trifortified product, if you've got a lot of neuropathy, I would even do up to 1 teaspoon twice a day, but at a minimum 1 teaspoon 1 time a day. Okay. The other thing I would do is repair the nerve cell membrane and the mitochondria. Again, use either ATP 360, 3 pills 1 time a day, or NT factor, 2 pills 3 times a day. You would not use the ATP 360 if you're not supposed to be on CoQ10 because you're taking atovaquone, Meperon, or Malarone. Okay? All right. All right. I just did you a quick summary because I talked about this earlier tonight, but that's what I would wind up doing for that. Okay? I'll do a quick screen share again to show you the article where you can read more detail about this. All right. So take a look again. In my online Lyme guide, take a look at the brain and nerves section and take a look at this article called Neuropathy Repair, Heal That Tingling, Numbness, and Pain. Okay? All right. Good luck to you, Damien. Thank you for that question. Hello, Lindsay. Let's see. Do you recommend DNRS? I think what you mean by DNRS is the dynamic, God, I'm going to blank on what it means. It's a way of retraining your nervous system so you're not as reactive. Do I think it helps some people with Lyme? Yes. And so, yeah, I think it can make a difference for some people. Not everyone, but some people it does. Okay? All right. Thanks for the question. Hello, Sharon. Let's see. Have you ever heard of a company called Mitosynergy and a product Copper One, which is copper as niacin, supposedly can cure Lyme? No, I have not. And be leery of anyone that claims they can cure Lyme. Okay, that's what I would say. I will tell you, I participate on a number of Lyme discussion boards with other healthcare providers that manage Lyme disease. No one is talking about this kind of a product as something that would work. So I would be skeptical. Okay. Also, I'm not aware of how copper and niacin would be adequate means of killing a germ. Okay. Ultimately, to get over this germ, you got to kill it. You either got to stimulate your immune system to kill it, or you got to use a poison like an herbal or prescription antibiotic to kill it. You got to kill it. And I don't see how copper or niacin would have that capability. Okay? All right. Thanks for the question, Sharon. Good luck. Hello, Anna. Let's see. If you suspect yeast or SIBO or both, how would you proceed? is 2 weeks of rifaximin good to start with? Okay. So by yeast, everyone, and I think means yeast overgrowth in the intestines. And SIBO stands for small intestine bacteria overgrowth, okay? All right, so both of them have one common thing. They both can lead to a lot of gassiness and bloating, okay? Small intestine bacteria overgrowth means that you got too many bacteria living in your small intestines, and they get there by moving up from the large intestines, right? You're not supposed to have many bacteria in your small intestines. If you do get bacteria living in your small intestines, basically they can ferment food, creating a lot of gassiness and bloating, okay? But also yeast can give you a lot of gassiness and bloating, so they're going to look pretty common, pretty similar, okay? In my experience, though, yeast overgrowth is a lot more common than small intestine bacteria overgrowth is. All right, so my approach, when I've got somebody that has a lot of gassiness and bloating going on, I will also ask, do they have sugar cravings? I'll look for other symptoms that suggest yeast to me. Sometimes with small intestine bacteria overgrowth, people have sugar cravings. Women will have frequent vaginal yeast infections that go with it sometimes. Sometimes people have difficulty swallowing because they actually have yeast living up here in their food pipe that goes along with it sometimes. And then yeast also can sometimes give people a lot of, can release toxins that can interact with your skin, leading to a lot of pimple or acne and even eczema type changes as well too. Okay, all right. So my approach, because yeast is much more common, and clinically, it is hard to tell the difference between yeast and SIBO, is to treat for intestinal yeast first. All right. And so I will use a combination of nystatin, and I'll use a diflucan, for instance. That treatment will work about 90% of the time over a 1 month period of time. Okay. Now, if that doesn't work, I may still treat another round of yeast, but if that doesn't work, then I might start wondering if SIBO is there. And the way to see if SIBO is there is actually, there's a way you can diagnose it, which is to do a breath test. And you do the breath test to measure the amounts of methane and hydrogen gas that you might make. All right. Now, to do that type of a test, you actually have to drink a sugar water first, called lactulose. Then you, over the course of either 2 or 3 hours, you collect vials of your breath. They're sent off to the lab, and we measure the amount of hydrogen and methane you make. All right. If you have elevated levels of either hydrogen or methane, that means you've got SIBO. Now, that test's ability to find if you have SIBO, it'll find it about 70% of the time. It is not 100% accurate, but pretty good. 70% is pretty good, okay? The gold standard way to figure out if you have SIBO, though, is to have a GI doctor scope you and pull off, aspirate, remove from your small intestines some liquid, and then send it to the lab and see, do you grow too many bacteria, okay? So sometimes I have to resort to doing that, all right? Now, about the SIBO, if you are a hydrogen-producing SIBO, that tends to respond about 80% of the time, I think maybe even up to 90% of the time, to a 2-week course of rifaximin, this medicine that you mentioned, okay? But if you have a methane-producing SIBO, 2 weeks often is not enough. And with methane-producing SIBO, you usually need to take a second agent, like a neomycin, for instance. So if I'm to do prescription treatment for SIBO in a methane producer, I'm usually going to do rifaximin, 550 milligrams twice a day in an adult, along with neomycin, 500 milligrams twice a day, and I might do a month or 2 months. It's really a lot harder to get rid of methane-producing SIBO than it is hydrogen-producing SIBO, okay? All right, so those are just some thoughts for you. I think I recently did an article on SIBO too. Let me go ahead and show you that real quick. Let's see if I did. I think I did. All right, so SIBO, yeah, there you go. So there's my article on SIBO and approaches to it. There's some herbal options you could use too. But the big thing I just want to let you know is, and there's a diet you can use. It's a FODMAP diet, which can be useful. And I talk about the hydrogen, methane producing. I talk about the different antibiotics and the need to treat longer term. Okay. All right. So you can take a look there. Okay. Now, in terms of treating yeast, take a look at my yeast chapter here. I did give you one option to consider treating yeast, and that would be to do the nystatin and diflucan combination. You can read about that here too. Okay. Now, one other thing, sometimes it gets really difficult to sort out whether you've even got yeast in you. All right. So one thing I'm starting to do more and more, if I've got somebody that's really gassy and bloated, I've treated them a number of times for yeast, and I still think it might be yeast, but they're not getting better. Before I go ahead and do my SIBO test, I might also do something called an organic acid test of their urine. And I'm going to look to see if they have elevated levels of an organic acid that can be elevated in yeast overgrowth, which is called arabinose. All right. And if somebody has marked elevations of arabinose, even though I might have tried a number of things to get rid of yeast, I'm going to still keep working on yeast before I start going after SIBO. Okay. All right. So those are just some things that I'm starting to do in my practice. Okay. All right. Thanks, Anna. Good luck to you. I just saw a message from a person earlier tonight who said that they couldn't hear me, but only one person said that. It looks like everyone else might be hearing me. Okay. All right. Let's see here. This is from Lawrence. Let's see. Hi, I'm currently seeing a well-known LLMD, and after the initial visit, he gave me a sizable list of antibiotics to layer on top of one another and take over a span of 12 weeks. I'm concerned about side effects, especially on the gut. Any thoughts about taking multiple strong antibiotics for that length of time? I think I have an idea which LLMD you're talking about. So generally, I don't like to have somebody just give them antibiotics and have them go away for 3 months before I ever see them again. And if that is the practitioner that's doing that, that's a standard for him. I think it's wrong. I think we need to monitor and follow you and make adjustments. Okay, number one. Number two, I will in my practice sometimes use 2 and 3 antibiotics on a patient, and I do it considering risk and benefits. Okay, so the risk and benefits are the risk of antibiotics. Any one of them might lead to liver inflammation, kidney inflammation. So periodically you want to do blood testing to make sure you're okay. The other potential harm of antibiotics, prescription antibiotics, more so than herbal antibiotics, but even herbal antibiotics can do this, is that you knock down good bacteria in your intestines, and that's called the microbiome. Okay. And one of the things that can happen is you can get too many yeast living there, but if you knock down good bacteria over time, we may lose some of the good function from that. Okay. So there is a risk in injuring the microbiome. Well, what does the microbiome do? Well, the microbiome does detox. It releases chemicals that can regulate your immune system. It removes things we're allergic to. It helps do digestion of food. It releases neurotransmitters for the brain. It does a lot of stuff, okay? And we're only beginning to scratch the surface on the importance of the microbiome. So if you're going to do things that might injure the microbiome, you better be doing them for good reasons, okay? And so that's weighing out risk and benefits. So the risk of being on multiple antibiotics is long-term, maybe doing some injury to the microbiome. But you have to weigh that against the risk of not treating your Lyme and co-infections and staying severely ill from them. So at times, the risk of injuring the microbiome might be worth it if you have significant and bad impairment from Lyme and co-infections, okay? So it's not an ideal world. Yeah, I mean, there can be harm that can happen from antibiotics, but there can be harm from keeping the dang tick-borne infections going on too, okay? So it's not an ideal world, but sometimes you've got to take the risk of injuring the gut so that you can get rid of Lyme and the co-infection, okay? But I don't agree with sending somebody away for 12 weeks. I like, after I start antibiotics with a patient of mine, have them back after a month and review how things are going and consider getting lab testing to make sure that they're tolerating things okay. All right? All right. Thanks for that question, Lawrence. Hello, Anna. Let's see. I tested positive for rickettsia, but negative for Lyme in Ontario, Canada. The doctor said my body was fighting it, hence no need to treat it. Should I get it treated? Thank you. Yeah, I would. I would treat rickettsia with at least a month of doxycycline. Often that's going to be enough for it, okay? But I would, to answer your question, okay? All right. Thanks for that question. Good luck to you, Anna. Let's see here. Hello, Lisa. Let's see. Hi, Dr. Ross. I wanted to ask a follow-up question from a few weeks past about SIBO. You recommended Cripps Pharmacy in Canada. FYI, they do not offer Xifaxan at discounted rate, but I was able to get a coupon and get it for $0 stateside. Would you recommend after a Xifaxan that I take GI NCAP, a supplement by Thorne to help with digestive issues? Thanks so much for your kindness. Okay. So what Lisa's talking about is a pharmacy in Vancouver, British Columbia, Canada, that has physicians that rewrite U.S. prescriptions. So I send, for my Canadian patients, I'll write prescriptions and send them up there. They'll get rewritten. But also they, before, used to also be able to get Xifaxan at a much lower price than what you can get it here in the United States. And I'm starting to hear within the last month that has changed, okay? But there was a time when you could actually get a 1 month supply, I think, for like about $150. I mean, it was really cheap up there. But that has recently changed, and I'm not sure why. I need to give them a call and find out what's happening with that. It was nice at one time to have that, okay? Now, if you're not all the way better after Xifaxan in 2 weeks, then you may need to consider, did it work? Did it work well enough? Okay. And I think I had mentioned that earlier. Sometimes you need to treat longer. Okay. In terms of GI NCAP, the GI NCAP can sometimes help heal, which is a Thorne product, can help heal injured, inflamed intestines. And so that might be something to give a try. Yeah. Okay. All right. Thanks, Lisa. Good luck to you. Hello, Clara. Let's see. Hi. Thanks for all your help to suffering Lyme. Question. You're welcome. Question. I'm taking doxycycline for the return of Lyme symptoms. Should I take at the same time cat's claw and Banderol? So, I can't tell you what you should do, but I can give you some observations. So number one, doxycycline is going to be useful to treat the spirochete form of Lyme. But Lyme actually exists in two forms, okay? So there's a spirochete, that's the corkscrew many of you have seen before, okay? And then also there is a microscopic cyst form of the germ, all right? And doxycycline does nothing for the cyst. In addition, it is possible in Lyme to develop a biofilm slime layer, okay? So you could use the cat's claw and the Otoba, which is the Banderol, because they've been shown to treat cyst and spirochete Lyme. In addition, lab experiments show they do a pretty good job of removing biofilm slime layer. And so, yeah, I have patients sometimes do a combination of doxycycline and the cat's claw and the Otoba as well, too. Okay? All right. Thanks for the question, Clara. Good luck to you. Hello, Robert. Hi, Dr. Ross. Thanks for all your help. You're welcome. Do you ever use monolaurin in your treatments? And do you prefer ATP 360 or anti-factor energy for mitochondria? So my preference, if you're not on coenzyme Q10, is to use the ATP 360. I'm getting better results with that. The lab studies that Research Nutritionals has done supports that as well too. But remember, if you're taking anything with a atovaquone in it for Babesia, that you do not want to be on ATP 360 because of the CoQ10 that's in it. Okay, all right. And see, do I ever use monolaurin? The only way, I mean, I know some practitioners. So monolaurin can be antiviral. It might also be antifungal or anti-yeast as well too. I will, if I make a decision about 9 months to a year into my treatments to start doing something for chronic viruses, I sometimes will use monolaurin. My preference, though, is to use olive leaf extract, actually. Okay? All right. Thanks for the question, Robert. Hello, Diane. Let's see. Hi, my daughter was put on 22.5 milligrams of hydrocortisone over a year and a half ago for fatigue. She has since been diagnosed with toxic mold illness, Babesia, and Bartonella, along with many viruses. We want to get off the hydrocortisone. What's the best way to slowly decrease? All right. So hydrocortisone, everyone, is a steroid. And it is also made by the adrenal glands. A normal amount of hydrocortisone that your adrenals would naturally make on their own can be up to the equivalent of 60 milligrams a day. Okay, so that's called physiologic dosing. So if you do 30 milligrams twice a day of hydrocortisone, that is considered to be physiologic dosing. So up to 30 milligrams twice a day would be physiologic. It's making the amount of cortisol that it's replacing the amount of cortisol that we would naturally expect your adrenal glands to make. Okay. Now, as you taper off of it, one would hope that your adrenals will start making more on their own. All right. And so generally a way to taper off any dose of steroids that you've been on is over the course of about 5 days, slowly decrease and then stop. Okay. So what you might want to do is, I'm not sure what size pill you have or how this is being done. Typically, hydrocortisone is going to come as a 5 milligram pill. So I'm wondering if you're doing 4.5 of those possibly. But what you could do is just start dropping by half a pill to 1 pill daily over about a 5-day range. That's how I would taper somebody off of this. Okay. All right. But I would also suggest you talk to your physicians to see what they recommend for that as well, too. Okay? All right. Good luck to you and good luck to your daughter. All right. Thanks, Diane. All right, everyone. So listen, that's it for me for tonight. That's an hour and a half we spent here talking away. I've had a good time being with you here tonight. So I will be doing another one of these next week. Okay, so I added one because last week I canceled. So I added another one into February. So next week I'm on again, and I look forward to seeing you back here again. I hope you'll sign up for it. Tomorrow morning, somewhere probably by around 9:30 in the morning, I intend to have my edits done on tonight's video recording and get it out to you, announce that it's done with an email that will go out to you. When you get that email, share it with everyone you know that has Lyme disease. See if they'll get some benefit from watching the video and learning about some of the ideas that I have here. Okay. All right. That's number one. That's your responsibility. Help me here. Okay. Number two, you'll also see in that email a sign up for next week's webinar. So you can sign up there. Okay. And, yeah, I think that takes care of it. So anyhow, good seeing everyone here tonight, and look forward to seeing you next week. And good luck this next week ahead. All right. Good night, everyone.